Hirschsprung disease. So this is also known as your congenital megacolon. So this is because of the absence of the ganglion cells, that is more specifically your Meissner's and your Urbach plexus, which leads to aganglionosis, causing the bowel failure to relax, as a result of which functional obstruction. Now, it always involves anus, internal sphincter and rectum. Now, it may extend proximally up to sigmoid colon, which is present in around 75% of the cases, up till proximal colon, which is present in approximately around 15% of cases, and up till terminal ileum, which is present in approximately around 10% of the cases. Right. Now, it may be associated with some genetic defects like your red gene, then ED-NRB and ED-N3 gene. Now, the clinical features: such patients usually present with delayed passage of meconium, abdominal distension and your bilious vomiting. Diagnosis is with the help of your rectal biopsy, and you have two important tests done over here, which is your acetylcholine esterase staining and your calretinine immunostaining. Now, this is your transition zone showing between your proximally dilated bowel. Now, this proximal dilated is your normal bowel, right, and over here the narrow, which is your pathological bowel, right. And your treatment would include your this 3 surgeries. So, first we have your modified Duhamel procedure. So, what happens in your modified Duhamel procedure? A ganglionic rectal stump is left in place. That means we do not do anything to that aganglionic rectal stump. Rather, the ganglionic normal colon is pulled behind the stump and a coloanal anastomosis is done. Now, in case of SOF procedure, another procedure is your SOF procedure. So, over here an endorectal mucosal dissection within the aganglionic distal rectum is done, and then the ganglionic normal colon is pulled through the remnant muscular curve and a coloanal anastomosis is done. Now, in case of your Swenson, the aganglionic bowel is removed up to the level of your internal sphincter, and then you perform a coloanal anastomosis. So, these are your few important points and questions that can be asked and that have been asked with respect to your Hirschsprung disease.